Get you in here, right?
Yeah, you're live.
All right, good morning. This is Senate Health and Welfare. It is Tuesday, January 28th. And this morning we're going to be introducing. Hello.
I'm trying to mute myself.
There you are. Is it Rebecca?
Yeah, I got it.
Okay,
Sorry.
thank you. That's good. Yeah, a little echo. So we're going to be hearing from folks at the Department for Aging and Independent Living, and I see another one up on the screen. Thank you, Stuart, for being here as well. So how do you want to do this? Do you all three want to come up? Or two, or one, or two? Bring another chair right up to the table, and then we'll introduce ourselves to you and then ask you to introduce yourselves as well. Dr. Bowen, you're relatively new to Dale. Introduced to all of us.
Okay,
All right.
so hi, I'm Dr. Bowen, Jill Bowen. I'm the commissioner for the Department of Disabilities, Aging and Independent Living for the past 9 months.
Okay. Okay.
And I'm Angela Smith-Jang. I'm the Deputy Commissioner at Dale as of December. I'm moving into the Board of Charge.
Well, we may as well keep going. Stuart, you're up there. Why don't you introduce yourself?
Certainly. Good morning, Senators. I'm Stuart Scher. I'm the General Counsel for the Department for Dale. Happy to be here.
And Rebecca Silvernagle, I'm the Principal Assistant at Dale.
Okay, so we'll go start here with
We have Amy Johnson.
Amy Johnson.
Amy Johnson, Veronica Carter, thanks.
I'm Senator Larry Hart from Orange County.
Senator Bogus from Orleans County.
Ginny Lyons, Senator from Chittenden Southeast.
Martine LaRock Ewart from Chittenden Central.
Havings from Washington District. And our assistant is.
I'm Kiki and I aid this. I'm Health and Welfare Committee.
Excellent. Is Joe part of your team? Yes.
Yes, he is a partner.
Well, Joe, why don't you introduce yourself as well?
Yeah, good morning, everyone. I'm Joe Nussbaum. I'm the Director of Dale's Division of Licensing and Protection, which encompasses Adult Protective Services and the Survey and Certification programs.
We actually have another one or two folks because we wanted you to just see who all were their division leaders.
Terrific. Thank you for doing that. It's helpful. So we will turn it over to you and you'll give us the high to the middle to the deep overview of what you do. We have until about 10:45 or 11, so there's plenty of time to get started. Not plenty of time to do everything.
Oh, okay. Not everything, okay? Just
Oh, well, that'll take months.
yeah. So you're seeing, just so that we finish the introductions, a couple more of our division leads. I think just to say hello. Fred, do you want to introduce yourself?
Sure. Hello, everyone. My name is Fred Jones. I'm the director of the Division for the Blind and Visually Impaired.
And James?
Hi, I'm James Smith. I'm the Deputy Director of Hireability.
Oh, one of my favorite things. This is a
Could break into song, yeah. One of my favorite things. Angela?
Good morning, Angela McMahon. I'm the interim director of the Adult Services Division.
And last but not least, Jennifer?
Good morning, I'm Jennifer Garabedian. I'm the Developmental Disability Services Division Director.
terrific.
It's our division.
Good. It's thank you all for taking the time to be here. It's good to see who you are, and then we'll be able to connect further going ahead.
Okay, so I'll just jump right in and
Please.
start with the high level.
Are you going to share?
I'm gonna, yep,
Rebecca's got it. Okay.
sharing is not turned on, sending a request.
That request is going all the way around.
I know.
Okay, I have you up already. So
Oh, yes, you did. Okay. It's not up here yet.
That's weird. So I thought, okay, here we go. There we go. It's just that there's a delay this morning, I think.
All right, it's what I mean, but.
And we have it as well.
Okay, so you're all good. Well, let's just start really high level as Dale's mission, which is to make Vermont the best state in which to grow old or live with a disability with dignity, respect, and independence. And we take that very seriously. It was, when I saw that and considering, a move to come to this position, came from Philly most recently and from New York before that. That mission statement really resonated. So it is an important goal for us to keep moving towards. Next slide is the guiding principles. And Dale is committed to strengthening the continuum of care for people with disabilities and older Vermonters. That means including enabling people to choose where they receive supports and services and to be fully included as members of their communities. So key issues there are community, and how important community is to healing and to wellness, and choice, which is critically important for people to have agency in decision making about critical issues.
Just excuse me for a minute. It kicked me out of the meeting and so it's working on it. So
Okay.
maybe, I don't know if,
Kiki can't do it. Yeah.
Okay. Okay, it's connecting, so I got kicked out.
Okay, well,
Maybe she should move out of that dead corner.
yeah, this is the bad part. Sit over here.
We've had
Let council in
I
here.
just sit over there.
See if it
We've
works.
had trouble with that one.
Yeah, we have. You're right. Thank you.
Okay, thank you.
Mark that one.
So.
One more over.
Well, I know that never's got the backbone, so.
That could be a good thing.
I'm back in.
We'll keep coming back to that.
Yeah.
Okay.
So I'll just continue because it's pretty high level at this point. And the commitment is underlined by state and federal mandates. So there are a whole slew of state and federal mandates that we comply with. Let's back up. So the APA, obviously the Americans with Disabilities Act, Developmental Disabilities Act, the OAA, and the Older Vermonters Act, Workforce Innovation and Opportunity, Vermont Healthcare Administrative Rules, Medical Global Commitment, the 1115 waiver, which is so critical for us, the CMS Settings Rule, the Olmstead decision, which of course requires states to provide service to people in least restrictive environments possible. So we are a very heavily Medicaid and federal grant funded department, and we comply with all of this.
Well, it's not just, right, as you said, compliance becomes the federal rules and regulations as well as state rules and regulations.
Exactly.
Especially when we go into CMS or Homestead decision or American with Disabilities. I mean, it's really amazing.
So the next slide, if you're on it, is the commissioner's office and the 5 divisions that comprise the Department of Disabilities, Aging, and Independent Living. So once again, the Adult Services Division, which the interim director you met, are you not advancing?
It's not able to, it's not listening to me.
All right, well,
Biden, you're moving up your seat.
We'll move right to the next slide on
yours.
If we have a handout, please go to the next slide.
Okay, for those who are watching, what's on this next slide is just identifying the 5 different divisions. The Adult Services Division that focuses on older Vermonters. The Developmental Disability Services Division, which focuses on those with developmental and intellectual disabilities across the lifespan. Division for the Blind and Visually Impaired, which focuses on folks with blind and visual impairment, but also disabilities in general in terms of collaborative work. Division of Licensing and Protection, which includes adult protective services as well as survey and certification. And then Hireability Vermont, which is dedicated to connecting people with job opportunities, those with disabilities, and and beyond that, with a focus on folks who are transitioning from school, and also employee support services. So that is the overview. But what I'm going to do now is turn it over to Angela to take us through each of those divisions, to go to that mid-level that we were talking about, to get a little bit more detail about what happens in those divisions.
Right. Thank you, Dr. Bowen. So we'll start with the Adult Services Division. This division is responsible for managing the full array of long-term services and supports for older Vermonters and adults with physical disabilities as well. So it's fun. Most of our funding to the Adult Services Division comes from Vermont Medicaid, also the Older Americans Act, and of course, general funds as well. The Adult Services Division works closely with community partners in terms of service delivery. So the area agencies on aging, home health agencies, the designated specialized service agencies, adult day centers, SASH, long-term care facilities, and many more. So together with those partners, the Adult Services Division really serves thousands of Vermonters. So about 48,000 people were served through the Older Americans Act services last year. So that's everything from Meals on Wheels to information and assistance, family caregiver support, etc. About over 8,000 people received home delivered meals as well through the Older Americans Act services. Over 6,000 people receive Choices for Care services across all of our settings. So whether we're thinking about someone receiving personal care at home, in an adult family care home, in a residential care home, or in a nursing home. And Adult Services Division does the eligibility and assessments for Choices for Care.
So good. That was what I was going to ask you to share with us, because some of these things are purely volunteer services for, like Meals on Wheels. And what role do you play in that? And then Choices for Care is one program, and then SASH is another. And maybe sharing with us what are the eligibility differences, just briefly, and how are they?
Right.
Adult. Just a quick snapshot of what those services are, because it gets really confusing out here in the real world, or not real world.
Correct. I'll do my best. So thinking the services that serve the most people, broadest group of people, are the Older Americans Act services. Those are for people who are 60 and older. There's no income test for those. So that's why you see that very large number of people served. For home delivered meals, for example, there are eligibility criteria for that. So it's a smaller number of people served. The majority of that funding is federal, but there is also a significant state match for that funding as well. The services, Dale oversees the services through our State Unit on Aging, but it's the area agencies on aging that manage it at the local level. They do rely heavily on volunteers for delivery of services, the home delivered meals. So all of the drivers who are doing those routes are volunteers.
I want to just say that I have been out on a listening tour all over the state and have met with several folks who are delivering the meals and several who are receiving the meals. And the volunteers are largely older Vermonters, who are retired, and is real benefits for them in terms of opportunities to socialize, to be engaged. Many feel like they want to give back. I don't think that the system would work without that volunteer cohort.
So we couldn't afford it.
Exactly.
And then there is some Medicaid donors now, including.
Correct. Right. We'll talk about that in our recent successes.
Okay.
In terms of Choices for Care, Choices for Care is Medicaid funded, global commitment funding. There are eligibility criteria when we think about financial. There's financial eligibility, and DEVA manages financial eligibility for Choices for Long-Term Care Medicaid, Choices for Care. And then the Adult Services Division at Dale does clinical eligibility. And someone must need significant support with their activities of daily living, ADLs. to be eligible for Choices for Care. We call it nursing home level of care. So someone could be served in a nursing home if they're eligible for Choices for Care, or they have choice and could receive that service at home if they have some natural supports as well. SASH, you were asking about SASH as well. SASH is primarily Medicare funded, right? And it takes a population approach. It's primarily in independent senior living across the state. It provides both a coordinator for a panel of individuals in a setting, as well as a wellness nurse. So it's really focused on prevention before people get to that set need for long-term care. So they're doing a lot of checks of chronic disease management, diabetes, blood pressure, those types of things. Also looking at people's, overall health and well-being, their goals to be able to stay in independent living as long as possible.
Several people I spoke with who are receiving SASH services or have that available said they might not have checked something out if it wasn't right there, or it wasn't someone that they had some sense that they felt comfortable with. So it's also preventive in a lot of ways, or early identification.
People staying at home as long as they can.
Right.
Yeah.
Right. Right, which also leads us to the last bullet here about adult day programs. We have almost 400 people served in adult day now. That number, as many of you remember, decreased significantly during the COVID pandemic when adult days were forced to close for over a year. And so they've been building back participation since then. And adult days can serve people, older Vermonters, people on Choices for Care, as well as people with developmental disabilities.
How many adult day programs have we got now? How many are open? Do we know?
I believe it is 12. I believe it is 12. Angela might be able to know that.
We haven't replaced the one that was in Barry's.
There is one in the works. There's one.
I know that's good. I worked at Project Independence.
Yes. Yes. So currently there's no adult day in the Rutland area or the Derry area. Those closed during the pandemic and did not reopen. But there are organizations in both regions working to bring those back.
Thank you.
Great. So
That was a good detour, believe it.
Thank you. I won't be able to dive as deep into the other divisions.
No, you don't have
but
to,
I
but
will. I'll call on my
those
friend.
come up frequently,
Yeah.
and sometimes, there's the distinction between Medicare and what the state does, and what's Medicaid and what's volunteer, and I think it at least gives us something to.
Great. So the next division is the Developmental Disabilities Services Division. Jen Garabedian is the director there. And as Dr. Bowen said, Developmental Disability Services Division supports people with intellectual or developmental disabilities to live, work, and participate fully in their communities, pursuing their own choices, goals, aspirations, and preferences. So the division works to plan and coordinate, administer, and monitor services, primarily Medicaid funded as well. For people with disabilities. Services are individually designed to meet that person's needs and goals. And the Developmental Disability Services Division provides the funding support, the system planning, the technical assistance to primarily the designated agencies and specialized service agencies that provide those supports in the community, training, quality assurance, monitoring, standards, all of that, the whole system approach. In addition, DDSD is also the division that holds our public guardianship program as well. So people who are court-ordered to have public guardians, primarily for adults with developmental disabilities, but also a growing number of older Vermonters age 60 plus on behalf of their commissioner. So when we look at the numbers in DDSD, over 3,000 people were served in the highest level of care, home and community-based services. Over 1,000 people served under the flexible family funding option. Over 600 people served in family managed respite. Over 400 people served in the Bridge program. Over 700 people served through the Office of Public Guardianship. and over 300 people served through Office of Public Guardianship's Representative Payee program.
That's a good question. Yeah, thank you. So when we see numbers like this, are there any folks who are being served by more than one, or is it usually just separate, very, distinct lines between all of them?
I do not want to misspeak, so I'm going to look to Jennifer to answer that question.
Yeah, so these numbers are unduplicated with the exception of the numbers related to family managed respite, flexible family funding and bridge program. Those would be services available primarily to children, so they may be accessing multiple services, but the home and community-based services is an unduplicated number. Also, individuals who have guardianship services may also be accessing REP payee services and home and community-based services.
Great, thank you.
And then Jen, the home and community-based services has a variety of programs or options.
Yeah, so that's right, Dr. Bowen. Within home and community-based services, there is an array of supports that an individual could be receiving. So while it is for the individuals who have highest level care needs within our service system, there is sort of a spectrum of supports that a person could be receiving.
Thank you. Right. So we'll move on to the Division for the Blind and Visually Impaired. This is our smallest division, small but mighty in terms of the work that they do. Division for the Blind and Visually Impaired assists individuals who are blind and visually impaired to meet their employment goals or their independence goals. So they focus a lot on skills development for jobs, career pathways, and independence, sort of on a lifelong journey. DVVI provides training for those employment skills and also for higher education to lead to degrees or certificates. They do a lot of work supporting youth to transition from high school into the world of work. So they work providing younger students to ensure that all students who are blind or visually impaired have pre-employment training skills for when they leave school. And they help individuals of all ages to build adaptive skills related to their visual impairment. So that's using things like assistive technology, orientation to low vision mobility, and independent living skills. So over 1,100 people were served by Division for the Blind and Visually Impaired through their different programs last year. And they've also provided through the LEAP program, which is Learn, Earn, and Prosper, a particular program for youth, over 2,000 hours of training for those students. And Fred Jones is the division director there.
They also each year do multiple White Cane Awareness Day events, so if you haven't had an opportunity, yeah,
right, interactive,
incredible.
Yeah, it is amazing. The amount of work I go through.
And then you'll learn about PGP when we get to recent successes.
Yeah.
DVDI is the least.
Okay, the next division is the Division of Licensing and Protection. As the division director, Joe Nussbaum, said, there's two houses or two branches of this division: survey and certification and adult protective services, both designed to protect vulnerable adults and individuals receiving care. So survey and certification is our state survey agency for healthcare facilities in the state. Their role is to license and certify these facilities to ensure that they meet minimum state and federal regulatory compliance. So that's all of our nursing homes, as well as state licensed facilities and a number of other types of facilities. Adult Protective Services, the other part of Division of Licensing and Protection, focuses on investigating allegations of abuse, neglect, or exploitation of a vulnerable adult. And then they implement protective services to limit maltreatment in the future. So just pulling out a few numbers from Division of Licensing and Protection. In survey and certification, they conducted 266 on-site investigations at almost 500 from 500 combined complaints and self-reports across facilities and providers. So in state fiscal year 24, APS received almost 4,000 reports of abuse, neglect, or exploitation in last year as well, and conducted over 400 investigations and over 400 assessments. With the new APS statute that took effect last year, this is the first year we have data of assessments by APS in addition to investigations.
Did we get a report on that?
There is a specific APS report.
Okay.
That has a lot more detail.
Yeah.
That has been submitted.
It's nice. Yes.
We got it.
You should have.
I know Rebecca's good about
Send it again.
sending us all the reports. You're very good about sending us reports. Too good. No, it's great. Thank you. Yeah, so I know that how many sites are you evaluating or inspecting every year? Licensing every year.
Joe, do you want to step in on that?
Yeah, I don't have the number off the top of my head. I can say that of all the licensed facilities, which are nursing homes, hospitals, res care and assisted living, all of those, we do schedule to have surprise unannounced visits once per year for all the federally funded and state facilities. So we're still in a little bit of catch up. There was a dip during COVID, but we're catching up on those numbers and mostly on track to meet those.
So if a family member or a patient offers a complaint to you, do you automatically investigate that or go in for an inspection on that complaint? How does that work? Just we got an idea.
Yes, it goes through a screening process, and both programs, Adult Protective Services and Survey and CERT, have their own statutory definitions. And if it rises to the level, we do go in and investigate. If it's unclear from the report, and this is where it was mentioned about the assessments on the APS side, it's been very helpful to be able to go in and assess, what we don't know to see if it does rise to that level for us to do an investigation.
Yeah, thank you. And then I know that we work really hard on financial abuse for older Vermonters. And what role, if any, do you play in that? You play a role.
Yeah, that continues to be the fastest growing area of maltreatment that we investigate. And I think we've made some pretty big strides that we're happy with, both in the new statute that passed for APS and in the partnerships that we've forged with the financial both financial regulation and financial institutions. We have a recent MOU that allows easier sharing of information. And we also partner regularly with the Attorney General's Medicaid Fraud Unit, which looks at those issues as well. So it's an area that continues to grow, and I think we're keeping up with it.
That's good. It's such a difficult area to be in, and it sounds like you're really on top of it, and I appreciate that.
Sure thing.
Okay, the last division of the 5 is our largest division, Higher Ability. Higher Ability also has the most staff out in the field. They're at district offices across the state. Higher Ability used to be known as the Division of Vocational Rehabilitation, but rebranded in a couple of years ago now to really promote the focus, the forward focus of hiring and finding careers. So the mission is to help Vermonters with disabilities prepare for, obtain, and maintain meaningful careers, and to help employers recruit, train, and retain employees with disabilities. And we're talking about disabilities across the spectrum, from developmental disabilities through to chronic conditions and physical disabilities. So Higher Ability serves people with disabilities who face barriers to employment. They really work one-on-one really closely with people to help them figure out what type of career they're looking for, not just get them a job, but find them, work with them on a career pathway. They do this through assessment and counseling and guidance and support, a lot of focus on post-secondary education and training to help people find good quality jobs with good wages as well. So about 150 staff located across the 12 district offices. A significant amount of collaboration through HireAbility as well, with many partners through from the business community, Department of Labor, higher education, et cetera. And when we look at the numbers in HireAbility, almost 7,000 individuals were served in state fiscal year 24. Over 6,000 people were served in the core HireAbility programs. And about 1,600 high school students were served through the pre-employment transition services. All of these numbers have increased from the previous year.
And I want to highlight the collaboration with the Department of Labor and with the manufacturing sector at a time when there's need for people to fill positions. HireAbility has stepped up to match need and training. So that folks can serve both for themselves in terms of their growth and their interest in their careers, and also to support the manufacturing sectors.
So this is the link with Weber.
Yes.
Yeah, and the type of the client you're working with, well, some are coming out of high school and maybe kids who might get lost in the weeds or caught in the cracks or whatever. And then you have others who are transitioning in different stages of recovery or out of corrections, whatever. Yeah, so
both of those pathways.
Yeah, no, the work is really significant, and the staff that you have is highly trained.
Yeah.
For this.
James, is there anything you would add?
Sorry, sorry.
There you go, there you go.
Took me a second to find the unmute. I don't think so. I think you covered it. The one detail is that we're mandated to spend 15% of our federal funds for students who are in high school. So that's what that pre-employment transition services number is. It's working directly with schools and students who are in high school.
Yeah, and I've been to some of the training setups that they have. It's amazing the range of types of programs that folks can get into, and the way the youth are engaged and just really jazzed about what their future could be based on the opportunities that they're afforded. Really a lot of hands-on and a lot of range of possible career opportunities.
I'm familiar with this because I know someone close to me who has worked with HireAbility in Middlebury. It's really, I'm always impressed with the work that goes on. And I've met with Labor.
So just to highlight some recent successes, we forecasted a few of them, but the Act 186 pilot was a housing project grant that is coming to fruition. There's 4 programs, 3 grantees, and there's one program that's actually up and has folks being served in the program. Riverflow, and it is amazing. And it's for folks with more complex developmental disabilities. It's a model for creating options in the for people with developmental disabilities and housing needs. And it is also coming to fruition in terms of having obtained various pathways to getting funding. And the other projects are also either have determined how they're going to be funding, or they're almost there, and some are building and standing up. So this is a successful pilot program. Some of them are already talking about expansion possibilities and options, And again, it goes back to having models that provide for choice.
So river flow in, is it river flow? Moncton?
Sorry, river flow is in Waterbury. isn't it?
No.
Which,
No, it's outside of Delaware.
Yeah.
which one's in Moncton?
Is it?
Anyway,
Jennifer, are you there?
Jen, is that the one in Moncton?
That one, I think.
Yes, river flow is in Moncton. I think the Water Street project is in Waterbury.
Yeah, that's
Yeah.
right. Sorry.
so but each model is different depending on what the community needs. And that's what I'm hearing you say. Yeah, for the pilot.
Exactly.
That's great. And so what are the plans? Do you know what the plans are for expansion at this point to other parts of the state? or-
So what I know about expansion comes from my visit to River Flow, because the
Sure.
others are still getting theirs set up and established, right? And Jen, you can correct me wherever I'm or where you want to add to it, but River Flow has a fair number of donors to their project, and if they have land where they have developed the first one that has 4 individuals who are, for whom that's their home, and it also houses 2 of their staff. So they all live together there, but they have pointed out that's where they're gonna build the next one up on that, up on that hill, and that's where they're gonna build. So they have several more in their planning stages to expand that program in that area on the land that they were able to acquire. Jen, do you want to say more?
Yeah, so you're right, Dr. Bowen, there was some significant philanthropy, but they also have done some public partnership. So they are leveraging available public funds to expand, to develop the first setting, but also as they look to do some expansion. Based on the success of their initial house, they have a fairly significant wait list. So their model is working and garnering a lot of attention. The other pilot grants are also quite popular, and as Dr. Bowen has said, moving forward with some pretty good speed. We expect that the Upper Valley projects, the one in Waterbury and Randolph, should be finished within the next 18 to 24 months. And then there's one in the Chittenden County area, which is moving towards implementation fairly quickly as well. Beyond the 4 settings, there's also a lot of expansion that was outside of the Act 186 housing projects. So we have had a lot of interest and work done. Also, I think brought upon the housing residential developer position that was afforded to us through Act 186. So that has also allowed us to help people as they've brought on these projects.
Right. It does, it does seem to me that as we are investing so much in housing right now, public money in housing, that this seems a good place to put it. It's something that we've talked about in here.
So another success was bringing Mission Care on in Bennington. And Mission Care is the first complex specialty care facility in Vermont. It serves folks who were kind of stuck in the system without having a facility who could meet those specialty needs. They include complex physical care, mental health, and physical needs, those being re-entering from justice system and other complexities. It opens in September 2024 and is very actively bringing folks into the facility. And we are tracking from where people are coming into the facility. Those who are coming from hospitals have been in those hospital beds for hundreds of days waiting for a facility. We have heard of programs where their intensive care units are now open again and flowing, or acute beds are now able to flow because there was so much backup. And they will be continuing to bring in somewhere in the range of 5 additional folks per month, who, again, they have the specialty skills and training to be able to work with these folks. Another success is new grants to AAA's for home delivered meals. This is an expansion to reach the most food insecure. This is Medicaid dollars. Dale is also part of a multi-state collaborative to support direct care workforce. This is critically important, and it wasn't just Vermont that was struggling, or that continues to struggle with direct care workforce. This multi-state collaborative brought best practices where there were effective programs happening. We're more than happy to learn from those who have had successes in different places, and also to learn from what hadn't been as effective. And we do have a multimedia campaign pretty close to being ready to roll. So you should be seeing social media, radio, TV. We should an effort to invite people into the direct care workforce. We have a fully staffed nurse survey team with newly adopted rules. We heard something about that, bring more oversight for health and safety at the state licensed facilities. Pathways to Partnership is a $10 million grant from the Department of Education. DBVI is the lead for this multi-department and agency effort to help transition folks from school to work for students with all range of disabilities. So we are very pleased that DBVI has been selected and has been working now for several months to coordinate across schools and across internal and external interested partners.
So is DBVI working with thinking Department of Labor, Comparability, or others? Does that work? Does that fit with that?
Yep.
Yeah.
Brad, do you want to just say who some of the partners are for P2P?
Sure, yeah, we have several partners. One of the major partners is Hireability. And then we have a lot of other partners like the Vermont Center for Independent Living, the Green Mountain Self Advocates,
Yeah.
the Developmental Disabilities Council, Resource, the UVM Medical Center for Deaf and Hard of Hearing, UVM Center for Disability and Community Inclusion. So yeah, it really is all about partnerships. And of course, we have 3 pilot schools this year, and next year we're expanding to 24 additional high schools.
Whoa, that's a lot of work.
Right.
Yeah, it's very exciting.
Yeah, it is.
So
Very exciting. So once you get this set up with your community partners, does it seem to run smoothly? Does it take some of the, does it make it take some of the burden off of you, or does it continue, it just magnifies it?
Well, I think where we are at the moment right now, we're in our pilot year with our 3 pilot schools. We're really learning a lot from the pilot schools, because what the partners can offer is significant, and the schools have a sort of their perspective on what they need. So we're in the process of really lining up, meeting the needs of the school and the students with the partners, and that's taking a lot of good, strong communication and working through how to best utilize the partners to meet the needs of the students.
Thank you.
So I'm going to speak to Chris, as I realize that we're close to time here, but just wanted to also, we okay?
Yeah.
Okay, great. I also wanted to highlight Hireability's opioid employment pilot, which was very successful, and they have now received opioid settlement money. They applied and were selected to be able to continue and to expand. And this is connecting people in substance use recovery with job opportunities. You know, what a difference that can make in terms of the trajectory of their wellness in their life, and what that means to the
Yeah,
community.
okay, I won't ask my question now, we'll get to it another time.
The
Way in
questions.
Okay, no question.
Oh, now I want to know your question.
All right, no, this is terrific. All these things are just
So important ongoing work is just the next slide. Just Age Strong Vermont has just completed its first implementation year. So it was a couple of years of planning. It's a 10-year multi-sector, multi-partner plan, multi-year plan. It's one of 5 in the country. It's an amazing organizational structure to really make a significant transformation in the support services for older Vermonters. As we know, this is an aging demographic in Vermont. About a third will be over 60 by just a few years from now. And it's really important that the goals that have been identified and the objectives are met. It's across the board, very comprehensive, and the year 1 implementation report is just about due to go out. So you will be able to read and see what has been happening in year 1 implementation. And just shout out to you and the team who, in her former role before becoming deputy, she led the Adult Services Division and was really instrumental in getting Age Strong up and running. Continue work to develop supportive housing models, transitioning to conflict-free case management is no small effort. It's for Choices for Care for brain injury program development of services, and it is going live this year, and it is a federal mandate, CMS mandate. And then also related to that is the developmental services payment reform, which is also rolling this year and will provide increased transparency and accountability around service provision and funding. So we're very much looking forward to both of those going live. And then collaboration with and support for providers across the continuum of care is a main just focus of what our activities and efforts are. Is there anything anybody would want to jump in and say that was critical that didn't come across to you?
I'll just jump in and mention, I did look up, it's 139 facilities that is under the survey and certification purview in Vermont.
Wow, it's a lot. Yeah,
Thanks, Joe.
thank you.
Everyone else? All right, then I guess we represented well the divisions. The next slide is just our contacts. You met everybody now, more division leads. This Ginny is our administrative assistant, and everybody else was on here. Diane, James represented Diane, and Laura is our deaf, hard of hearing, deafblind director. Otherwise, you'd have met the crew.
Well, and I'm thinking about all of the work that you do right now. What is the workforce situation within the entire department? And then I know individual sectors will probably have significant needs, deficits, whatever. But can you just give us a look at what the workforce issues are within the department?
Yeah, I mean, there are still vacancies. Like in other places, particular positions are particularly difficult. Nursing, we have been, somewhat successful in recruiting nursing, but there's still challenges. Investigators, nurses, some of the harder to fill positions. Would you add to that?
Yeah, I think our workforce though is stable, right? We're
Internally.
Yeah.
Internally, and what about the field?
The field is harder.
Yeah.
The field still struggles. And, it's important to note that still remains a challenge across the country and in New England in particular. Yeah, that the workforce, again, nursing, it's stabilizing just a little bit at the hospitals. But in nursing homes, for example, where it's LNAs and other individuals who are really the backbone of that is still really difficult. And we still are facing traveler and the associated costs related to it.
So we were very familiar with traveling nurses and then somewhat familiar with some of the traveling counselors. What travelers have you in your different divisions?
The contract nurses again.
Certainly nurses, RNs, but also traveler LNAs.
Yeah.
Yeah,
Right,
really.
the licensed nursing assistants for nursing homes. Yeah.
And that is a big driver, of inflationary costs and other challenges for nursing homes and other. So we still do very much have a workforce challenge with our partners.
And in our home and community-based services, I would say, whether we're talking about home health agencies or designated agencies, there, the workforce shortage is very big.
And the direct care workforce, which is why there's
We're investing.
effort, yeah.
So as we'll have a conversation in here regarding workforce and are the things that we can do that will help you increase the workforce that you need. We've been working on peer support services within the mental health and substance use disorder area. We've done some work on certification with LNAs and so on, but what more? And we've done nursing, we've done a lot of work in here and in collaboration with our friends in economic development across on the other side of the State House. So, if you have suggestions, and I can see some of you up on the screen, or so you're shaking your head, or you understand the issue so much better than we do within your own area. So it would be helpful to know, are there some cracks that we can fill, some gaps that we can fill that would help bring in or maintain folks?
We appreciate that. Do you want us to highlight a few now? We'll come back and have a conversation.
Well, yeah, bring it back, I think. And if there are specific things that we can get in writing that we can work on, we'll do it.
We appreciate that. And we appreciate.
We are not the money committee, but we do have connections.
Still appreciate it. And you have a bank. What was that? Over there?
Used to be the treasurer's office.
Yeah.
Judiciary room, and that was the treasurer's hall. That's they store paper in it now.
I guess it's not paper money then. I guess.
So, committee, any questions or comments?
I have the workforce question, sorry.
Yeah.
You already asked it.
Did you have a question?
She already asked it.
Oh,
Well, great minds. Go ahead.
thank you, Madam Chair. So I have two things to bring up to you. One is I'm just kind of looking for a little bit of information. So one of my constituents he's a retired construction worker, but he's been working throughout his other years. And he fell off the roof, landed on a big pipe right on his back, snapped his back, and he's been on disability ever since. But that disability comes nowhere near enough to afford his bills and the bills of his wife. So his son and his daughter-in-law, they can't support their own bills either, as young people tend to struggle with bills. So they moved in, and now we're all sharing one house and trying to afford everything together. And he, as a retired construction worker, he would love to be able to build like picnic tables or things like that to be able to supplement the disability. But he's told me that if he does something like that and the state finds out, then he'll lose his disability because he's working and he's getting more. Yeah, and he's getting income brought in. Yeah, and so I don't know the exact
You're
requirements
talking
of
about
disability
benefit losses if he starts making money and the other things. Jen, do you have anything you can help with this or the?
So, I mean, there are some thoughts that come to mind. I would be happy to work with you through Rebecca around some potential options. I'm wondering about like an ABLE account that might allow for allowable savings. That could make this a possibility for the individual. Certainly would be happy to work with you around some of those thoughts, pull in our experts through the Rep Payee program who would have some more information about sort of those, what's allowable, what's not allowable. There are ways that you can save money above, like in an allowable savings account. program, stuff like that. So happy to connect with you around that.
If I could just quickly add to that, if this person is on Social Security, SSI or SSDI, federal benefits, Hireability has what they're called certified work incentive counselors who can help people understand if they go to work, because there are work incentives built into those programs. If they go to work, how much they can earn, retain their benefits, or retain their health care, whatever's the most important to them.
So those pressures are real that you're raising. I've heard them from several people with all kinds of different disabilities who are trying to make their way by being employed, and some of those pressures. I think, James, what we're going to do for James and Jennifer through Rebecca is make sure for the individual constituent that you're raising, but in general, we have been trying to get across information to folks about, so that they even understand what their options are in these situations. So thank you, guys.
Yeah, it'd be very useful if I could get some information for able to email that to me. Because if there's anything that I can do for him, that'd be wonderful. You know, he's disabled, yes, and he struggles with mobility and you know, having strength in his hands sometimes. So he might not be able to go back and do roofing, but he's told me that he's able at his own pace to be able to work in a workshop and build things he could sell, but he's been told that he can't do that.
Yeah, so let's see what's possible.
You know, it's
for
all
the
at his own
gentleman.
pace. It's all at his own pace.
And really our focus is on ability. So it's what is possible and what he can do and what he would like to do.
Right, no, this is a great situation, and it's something we probably should dive into, or at least hear your thoughts on it. And the other one, of course, is people going into nursing homes and paying down all their resources to
how much
get to
income
Medicaid.
Medicare.
Yeah.
So they get
Medicare,
to, well,
Well,
how much it will
Medicaid,
cover.
Medicaid.
Yeah,
And how much you're allowed to keep in income.
right.
As your taxes have gone up and other things, need to make sure that's an adequate amount. Because I don't think we've looked at that in years.
We looked at it a little bit last year. Oh, yeah, and we have looked at it, but it's like one of those
But I've gotten complaints.
federal. Oh, yeah.
Yes, and also with the age demographic, we need to know that whatever the challenges are will be growing.
Yes.
Yeah.
Right.
Yeah.
Our demographic.
That's the cost. These are these.
Yeah.
Yeah.
What's going
Second,
on?
Just you had another.
One last question.
Yeah, last question. So, a lot of the veterans that we have in the state are seniors as well. And, you may or may not know, there are currently two bills, one in the House, one in the Senate. On the Senate side is S-17, that would provide, veteran benefits to be exempt from income tax in the state of Vermont. And I wanted to get, either your opinions or the opinion of your department, on the, use of that legislation.
Well,
Should I warn them that that bill is in my committee?
Could you, I think it is a finance question. We don't want to put you on the spot.
yeah, I mean, there's just a lot of need out there. So, and I've been to the veterans home, you know, the veterans are, it's variable in terms of what they have and what is available to them. I think, you know, you have to look at the whole picture in terms of what the needs are for older Vermonters. Veterans in particular, we owe, you know, we owe so much to the veterans. So I'm very interested to see where this goes and how this flows with those bills and what the implications are, you know, wider.
The real issue is the guys you see on the movie Warrior ads that came back, no arms and no legs. They don't get pensions. They're frequently on SSI, they're working, they're living at subsistence wages. And we have to be careful. We raise the food stamp allocation, they get thrown off because they're getting too much. And we tried to get that up.
There are some related questions with your first question.
Yeah.
Again, how do you move the services and the benefits, and also encourage folks to be working to the best of their abilities. Yeah.
Okay, one more question.
Well, actually, it's not a question.
All right, go ahead.
Well, or maybe a question for Sam, but it just, I don't want to get too far into this. My question about that, Bill, is everyone getting the same benefit if you're a well-paid colonel or general who's got an incredible retirement, or is it just for the like enlisted men in the lower ranks? Because the pay differential is huge.
It's everywhere.
And it's everyone.
And you have to be in the one.
So what I'm gonna suggest is that we go off live and we adjourn for the day, but allow the conversation to continue. Because we have two members of finance here are talking with another committee member. Thank you. Can't tell you how much we appreciate your time. And you will all be back at one time or another. And thank you all for your work. The slides on the good things is what we need to hear. Because we see bad things coming. And hope not. But thank you.
There's plenty of challenges.
Yeah,
I
challenges.
anticipating, has there been,
We go up on it.